Major concerns have been raised over tens of thousands of seriously ill people in England who may not be seeking help because of fears that they might catch the coronavirus in hospital or be a burden to the NHS. The number of visits to A&E departments has fallen by more than half since the outbreak began. Doctors worry that serious conditions like heart attacks and strokes are being overlooked. There are concerns too that other treatments have had to be delayed while the NHS focuses on tackling the coronavirus. Another 428 deaths have been reported in the past 24 hours, bringing the total number linked to coronavirus across the UK to 33,614. Here's our health editor, Hugh Pym.
Plenty of staff and not many patients. It's got a little busier here in A&E in recent days, but not much. Like many other hospitals, they saw an astonishing drop in the number of patients coming through the doors last month.
April here was busy from a COVID-19 perspective, dealing with sick patients. It was all very calm, controlled and safe, but we were busy from that perspective. But we saw a real drop-off in demand of other types of patients that we usually see.
Normally, assessment cubicles in A&E would be pretty busy, but right now, all these ones along here are empty. They're for non-COVID patients. It's a sign of how different things are right now. The worry is that people who might need urgent care are staying away because they're scared of catching the virus. The message from all hospitals: we're open for business and patients who need treatment should come in.
If you are concerned about having a stroke, a heart attack, perhaps cancer, do come forward, and at the same time the NHS will be redesigning the way in which services are offered to keep them safe.
The latest figures for England show that A&E visits fell by nearly 57% in the year to April. The monthly total was below 917,000, the lowest since records began in 2010. There are no comparable figures yet from other parts of the UK. The number coming in for routine operations fell by nearly a third in the year to March. It was about the same in Scotland. All non-emergency surgery was postponed because the NHS needed to clear beds for coronavirus patients. But that's left others like Helen frustrated. She was told she needed a hysterectomy urgently in February. It didn't happen and she hasn't heard any more.
If something is deemed urgent, it's deemed urgent for a reason. I think there are an awful lot of people who have various conditions that are being put at very, great risk of further damage due to these precautions being taken.
Jane has been waiting since February for a gallbladder operation and again hasn't been told when it could happen.
I understand that in this current situation that, I'm not a priority. I understand that fully. It does concern me that I'd like to get it over and done with, really, and, so that I feel that it won't build up again and there won't be any further problems.
NHS England has now told hospitals to restart non-urgent operations and procedures, but patients will be instructed to self-isolate for 14 days beforehand, along with members of their household. A reminder of the continuing concern about the possible spread of the virus. Hugh Pym, BBC News.
A new blood test which can detect whether someone has been infected with coronavirus has been given the go-ahead for use in England. The antibody test has been developed by the Swiss drug company Roche. Frontline workers will be the first to use it. Scientists have called the move a very positive development, but it's not clear yet whether antibodies actually protect against a new infection. Here's our medical correspondent Fergus Walsh.
Sharp scratch.
It's what millions of Britons want to know. Have they already had coronavirus? Now it's possible to find out for sure with a blood test. It has to go through lab analysis. This can be done by hand, like here at Imperial College London, or in an automated process, like a new highly accurate antibody test approved for use in the UK. If you get infected with coronavirus, your immune system starts to produce antibodies. These become part of your immune system's memory. So if you get exposed to the virus again, they should attack it. But how much protection they'll give and how long that immunity will last is unclear.
For some coronaviruses, we know that protection can fade, and we know from experiments many years ago, for example, that it's possible to reinfect individuals with exactly the same coronavirus, maybe a year later, even though they developed antibodies to start with. And so we have to be careful to assume that any antibody will last a long time.
Roche says it can provide hundreds of thousands of its antibody tests to the UK each week. Pharmacies and health clinics could be involved in collecting blood samples.
I anticipate that it will be rapidly rolled out in the days and weeks to come, as soon as it is practical to do so. I also anticipate that the focus will be on the National Health Service and on carers in the first instance.
There are several other types of antibody tests which only require a finger prick of blood, some of which are being trialled by NHS staff. Despite buying 3.5 million of them, the government concluded none was accurate enough. This is another way of testing for antibodies. You prick your thumb and then apply a blood spot to this piece of card, which is then sent off to a laboratory for very sophisticated analysis. That dry spot blood test is being developed at Imperial College London. It's planning to send out 100,000 home testing antibody kits once they're proven to be accurate and easy to use.
The swab goes right to the back of the throat, both sides by your tonsils.
Remember, it's a swab test like this which will show if you're currently infected with coronavirus.
Thanks very much.
So this remains crucial in preventing the spread of the virus.
Well, meanwhile, a clearer picture is beginning to emerge of the scale of the coronavirus outbreak in England. Official estimates suggest that during a 2-week period at the start of this month, nearly 150,000 people, or 1 in every 400, had COVID-19. Well, Fergus is here with me now. And crucially, these were not people in hospital or care homes.
Yes, this came from a survey of 11,000 volunteers around England who perform swab tests at home. And from that, the Office for National Statistics has worked out that around 1 in 400 people in England at the moment have a current coronavirus infection. Now that means outside of hospitals or care homes, your chances of bumping into somebody on the tube, the train, the bus in your daily life with coronavirus is quite low. But still 150,000 people, social distancing remains crucial because we don't know who those 1 in 400 people are. And that's why testing and tracing people who have a current infection are vital if we're to bear down on the virus.
We also got more information today about those who are being worst affected by this virus. And it seems that if you have diabetes, you are particularly vulnerable.
Yes, 1 in 4 deaths so far in English hospitals are of people who had diabetes. Now, in most of people with diabetes over 65, where most of the deaths are with coronavirus, it's about 1 in 8 people have diabetes, but 1 in 4 deaths, so double the background proportion. Now, we don't know why that is, but we know that diabetes can lead to a weakened immune response. One other thing, Sophie, 19 out of 20 deaths so far, all those people have had some kind of underlying health condition like heart disease or lung disease.
Fergus, thank you.